All right, we are on. Welcome, everybody, to this week's episode of Weekly Dose with Dr. Uday. I have an amazing guest with me today, Dr. Isabelle Amigues, and she is coming to us from Denver, Colorado. And she's going to be talking to us all about gout. I see quite a few patients with this, and so this is going to be quite informative. So before I get started, I'm going to start with introductions, and then we're going to get right into what we have. So I'll start with myself. For those that don't know me, my name is Dr. Uday. I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a primary care practice, namely Apple Valley Family Medicine. I also provide aesthetic services. And with both modalities, my goal is to have my patients not only feeling good, but looking good. So a little bit about Dr. Isabelle Amigues. She is a rheumatologist. She's trained both in Paris and Columbia University in New York City. She's based in Denver, Colorado, just like I said. She's a contributing author to multiple scientific articles. At age 40, she was diagnosed with stage 4 metastatic breast cancer. Her journey through cancer inspired her to learn more about the power of alternative techniques such as meditation, visualization, energy, healing, and love. She has incorporated her newfound knowledge and experience of alternative techniques into her current practice. That is beautiful. Welcome, Dr. Amigues.
Thank you so much for having me.
Yay. All right. So we're actually just going to go right into it. So the topic is gout. What is it from your perspective?
Yeah, great question. What is gout? So, gout actually is the endpoint of an accumulation of too much uric acid. And I'm not so that those are like crystals, and so it can crystallize and cause deposit into your joint, and that can become very inflammatory, causing pain, swelling, warmth, as well as fever. When you have so much, you can actually develop fever. So that is what we call gout. Gout is really like joint the joint manifestation of too much uric acid.
Absolutely. So you kind of went into it a little bit. So the symptoms that people would expect from gout.
Yeah, absolutely. So before I go over this, I think it's really important to take us back and to realize that, yeah, I could talk on a joint, and we can talk on knee joint. But
Mhm.
very often, what I'm realizing is that a lot of patients, they actually have over manifestation of too much uric acid in their body.
Mhm.
So, and so if you have had once or twice some kidney stones, you
Mhm.
have to know that that can be associated with gout. So if you have had kidney stones and if you have joint pain that's inflammatory, and we're going to talk about it, then you have to think, oh, could I potentially have gout?
Mm.
Okay. Because really the endpoint is like the main issue is this accumulation of uric acid. And we'll talk more about this if you want. But the presentation in terms of gout is usually it's someone that really likes to live, right? So it's someone, like we call that a bon vivant in French. It's
Oh,
someone that likes to eat, that likes to drink, that likes to have fun, right? And there's nothing wrong about this. The issue is if you have pain. And so we want you to have a good life without pain, right? And so the presentation usually, like, in books, if you read, it's going to be toe that's swollen, the first toe, the big toe on the side that gets very swollen, very painful, very red, very warm. And basically, the pain is so severe that even the touch of a sheet would actually be painful. It's like one of the worst pain you can ever have. And so when you have that, very often as rheumatologists, we're like, yeah, this probably is gout. And then you look for other signs. So if there has been a kidney stone, then you're almost certain that there's gout, absolute gout. And then you check, some blood work, but really like the pain. And so, yes, gout likes the foot. For some reason, it really likes that first toe. But you
mhm.
can have joint issues all over your body. So you can have it after the toe, like the second most common place is the knees. You
Mhm.
can have one knee or two knees that are involved, like both knees that are involved, but very often it's just one knee. And then it can happen also in the fingers, in the wrist, in the elbow. Elbow, it loves the elbow as well, shoulders, etc. So really it's just an inflammatory type of pain. And when you have it, like it's really a horrible pain, something that, wakes you up. But so that's the presentation. And of course, if you have a lot of burden of your joints, you can develop fever. And what's happening, and so this is where it's so important for me to educate both
Mm.
patients and their physician, is that the presentation of gout can really look like you have septic arthritis, which is when you have an infection of your joint. And it really can look the same. It's like just one joint, and or maybe two, but it's like super swollen, super red. There's like, when if you we were to take the temperature, there's fever. And then the blood work shows, that you have elevated white blood cell, which is something that we see with infection, elevated CRP, ESR. And this is where it's very unfortunate. I've had patients who had their toe cut
Wow.
because they thought that this was an infection of the bone. And they're like, it's not. It's really just gout, and gout can be very inflammatory and very destructive. And you have to make sure that this is not gout before.
Now,
Um,
feeding into it, but I was going to ask formally how you diagnose it. And so
yeah, it's
diagnose.
very good. So up till recently, the diagnosis was made like the gold standard, and I think it still is. The
Mhm.
gold standard is to do an arthrocentesis, which is basically getting some fluid from the joint. So for your patients, right? So like imagine that this is your knee. Like actually, it would be like this, but
Mhm.
that's the joint, right? Like one end of the bone, the other end of the bone, they sit, but they sit on fluid. And so I'm trying to create like this pocket, right? There's a pocket that's there, and
Mhm.
inside that pocket there's fluid. And when there is inflammation, that fluid is going to go up, right? And so it's very easy to get some fluid out and send it for analysis. And you send it for analysis, usually it looks very inflammatory,
Mhm.
but what's really going to tell you that this is not infectious is, one, there's no infection, so you don't see bacteria and so on. And two, you can see crystal of uric acid in it. And it's quite beautiful, actually, to watch. Yeah.
For the doctor, it is. The patient, they're like, "Mm."
Yeah, I mean, it's not, I've shown it to some patients, and they also thought it was
Oh,
beautiful. They were like, "Oh, this is the gift that doesn't give." It's beautiful, but I don't want it. And I'm like, "Yeah, I agree. Let's take it away." But yeah, so that's number one. That's the most common way to diagnose it. And again, before you remove a toe, get some fluid out to just make sure that you don't have gout. So that's number one. The
Mhm.
number two is you can actually kind of be pretty suspicious of gout if you have had kidney stones, and the kidney stones were not radio opaque, so it wasn't the calcium kidney stones. And if you have toes that are involved, so what we call podogra, which is that first toe that gets very inflamed. Those, like with this, you're like, and you have an elevated uric acid in your blood, you're pretty sure you're dealing with gout. But the gold standard really is that crystal seen on synovial fluid. And then there are, new ways to diagnose gout, which incorporates ultrasound. And it's really cool to have the ultrasound do that for us.
That's awesome. Okay,
Yeah.
so let's lead right into treatment. So, what are the options on treatment for the patient?
Yeah. So the first thing to think, all right, so you have an issue with uric acid. All
Mhm.
right. I mean, not you. When you have gout, there's an issue with uric acid. And so you always have to think the uric acid comes from the breakdown of usually cells, right? And so what's happening here is either there is an issue with getting rid of the uric acid and you don't get rid enough of that uric acid. So it's the kidneys that are a problem. And the truth is that we see more gout in patients who have kidney issues, right? Okay. Or there is too much production of uric acid, or too much production of uric acid. And the main cause of this overproduction is usually is because you're eating too much, high purine diet, which is basically a lot of animal protein, and
Mm.
that can cause that, and or just too much protein. And so when I was saying bon vivant, when you're eating, when you really like to eat a lot, and that's the issue, is that if you love seafood, red meat, and that's all you're eating, you have a lot of chances to get a gout, especially if suddenly, one of your dog is putting a blood pressure medicine or heart failure medicine, and so then your kidneys are trying to do their best, but then you have too much uric acid. So once you understand this, then you're like, oh, then there's things that I can do.
Right.
Number one, right, is I'm going to try to eliminate or decrease the amount of purine that I'm eating. And so that's what we call a low purine diet. And, I know that we talk a lot about this, like the whole food plant-based, but there's a reason. It's just better for our body. And so that's pretty much what I recommend, which is like, if you do a whole food plant-based, you have a low purine diet. Because what causes gout? It's usually eating a ton of red meat, eating seafood, because it's really it's really rich in purine, and the rest really is not as much. I've seen patients have a gout flare because of mushroom, or but usually, or beer. But usually, like, try to decrease the beer, try to decrease the red meat and the seafood, and normally you should be much better. Now, yes, some patients, they are able to get rid of their gout with this, which is wonderful, right? Because it's the best when you don't need medication. And some of the ones, it's not enough, and you have to realize this is also that can have a part that's genetic component to it, and you're just unlucky, and that is what it is. And because you have this unluckiness, you have to realize you probably have some other health luck, right? Because the way that we have evolved, and like the human body has evolved, there's always a reason why things happen. So yes, maybe you have gout, but maybe you had less of something else. Okay. So then the second part would be, once you've done the low purine diet, is to actually try to decrease the uric acid production. And so we have many treatments, no, not that many, but we have treatment, we have options. We definitely have more than 30 years ago, which is great. So you may have heard of allopurinol, Urorec, and so on. But so that's to decrease, like, to help removing some of this. And then what you have to realize is this is helping the uric acid levels in your body, but it doesn't help with the pain. And in fact, because you're moving the uric acid level, you may have a flare. So you have to really be clear when we have patients that are starting their treatment, that we have to start this allopurinol, or whatever we start you with a medicine that's going to decrease the pain associated with flare. And so that is a colchicine. Usually I love colchicine because it's not renal, like, it doesn't cause too much renal issues, but some of the people will just give anti-inflammatory. And the reason I always do that is, one, most of the time the patients come with pain, so you want to decrease the pain. And second is that the moment I'm going to start a uric lowering agent, I want to make sure that we don't have pain. So we just give this so that there's no flare. Because the worst is when patients start this, uric lowering therapy, develop a flare, and I'm like, I'm never going to go on this ever again, because you are the reason I got a flare. I was okay, and then with you I got a flare. So you don't want this to happen. And so that's the rookie mistake of the medical student, that's not properly supervised. But yeah, we are putting both, but those, like, and the last thing is to decrease the risk factor, meaning that if you got the first gout and you're suddenly having a bunch of gout flares with a diuretic, which are like a medication that your doctor is giving you, talk to your doctor to see if there's another medication that potentially could be given instead of that one, so that you don't develop this gout flare. So like a blood pressure medicine that's a diuretic is great, but if it causes a gout flare, maybe you want another one. So those would be the principles.
I love it. Thank you so much. This was so informative. So I'm actually going to switch gears and ask a few questions about you. And
Okay.
so one of them I always ask is, why do you do what you do, Doc?
Oh, wow. What a great question. I love what I do. So I did it twice, right? I did my training in France and then I did it again in the US, even though I had the opportunity to choose something else. And I was like, no, I'm not choosing anything else. I love rheumatology. So rheumatology is a really cool specialty because it's super intellectually satisfying. It's very it goes into the science of things at a very like small level, right? We are looking at the cell level or even at the molecule level with the cytokine, the inflammation, and so on.
Right.
And there's three things that I love in medicine. Number one is the diagnostic skill, so the detective work. One of my favorite things is to have patients who are coming with unknown diagnosis. Like we don't know what's going on. They are not doing good. They are not doing well. They may
Mm-hmm.
have seen like 5, 6, 7, 8. Sometimes I've had like people who have seen like 10 different people. And I get to put it together and be like, I think you have this, and we're going to start this treatment. So
Right.
that's the detective work. The second is I think we have amazing drug in my specialty, and so to see the patient get better is super rewarding for me. I love this, and our treatments are super good in the sense of they are very little side effects. And so it's super rewarding as a physician to see your patient do better. Like, I mean, there's nothing better for me than see my patient live a fully, completely normal life. And then the last thing, which is kind of going with all of those, is that because a lot of our conditions, rheumatologic conditions, are chronic,
Mm-hmm.
meaning that, yes, I'm going to get you to remission, but you need a treatment for that remission. So I'm going to be in your life on a regular basis. And I love that relationship. Like, that's the reason I did direct care, because I was like, I want to see my patient. I want to be part of their life. I want them to be part of my life, and they become family.
Uh,
And I just love this. And so I get to have this with my patients in rheumatology. So
uh,
it's really like it's just the perfect word for me. So that's why I did it twice, and I would did it do it again and again and again. I just love it.
oh, so it's so lucky to have you. Now, the second question, is completely different. And the way I asked that question, if you could meet your 20-year-old self with all the experiences that you've had thus far, what would you say to your 20-year-old self, or what advice would you give yourself at that age?
Huh. That's a good one. So 20 years old, I was a medical student in Paris.
Mhm.
Um,
And there's no right or wrong answer. This.
I know. Yeah, no, that's such a good question. I think, what's super interesting is that I've always lived my life at that age, especially. I would always be like, I can do whatever I want, but the future me needs to be proud of who I was then. So, like
Mhm.
when you're a student, there's like tons of opportunity to have fun, and I did have fun, but sometimes I would stop myself in having fun, being like, okay, would the future me be proud of what I'm doing right now? But yeah, let me think. I think i think the biggest thing for me, and that came really like at 40, right? With this cancer threat, not
Mhm.
threat, I don't like this cancer scare and this cancer realization.
Mhm.
The biggest thing for me was to realize that the most important thing in my life is relationship. And
Mhm.
I think at 20, probably I would have said, make sure, well, I think I was taking care of my relationship, but be okay. Like, it's going to be fine. Everything is going to be okay. Like, I think if I could say this, like, everything is going to be okay.
I love it. I
Yeah.
love it. Thank you so much for all that, guys. You didn't realize it was going to be this good, and it was. Thank you so much. So the last question is, where can people connect with you? Where can people find you?
Yeah, thank you so much. Well, thank you. First of all, thank you. Those are fantastic questions, all of them, and your patients are so lucky to have you. So yeah, I am. I'm in Colorado. I also have license in Wisconsin and Michigan, and so I'm right now I'm focusing my practice in Colorado, but I'm about to open it to more states because we have telehealth now, and there's a lot that I can actually do through telehealth. And in general, my practice is called Unabridged MD. So it's Unabridged MD. Currently, it's Unabridged MD in rheumatology because that's what I do. But I'm really hoping that we're going to expand it and we're going to bring, I really would love to bring acupuncture and Qigong and Reiki and Tai Chi and then maybe energy healing because I'm really fascinated by that. And so you can find me at unabridgedmd.com. That's my website. And all of the different social media, Unabridged MD. And I talk a lot about rheumatology, but I also share my like some things that have really helped me when I was undergoing cancer therapy, and even when I have to do my scans regularly, like the fear with tests and so on. So it's really just being super vulnerable because, again, the most important things for me, at least in my life, is the vulnerability and the relationship, because I really do think that people are good, and so they deserve the best of me. So that's where I am. So unabridgedmd.com and all of the social media, Twitter, TikTok, I think just started, Instagram, Facebook, unabridgedmd.
That
Yeah.
is awesome, guys. So check her out. Thank you so much, Dr. Amigues. And for those of you out there looking for a primary care doctor, quality primary care doctor, we're accepting new patients at Apple Valley Family Medicine. Our phone number is 304-350-1087, and you can find us online at www.applevalleyfamilymed.com. So look us up. And you guys enjoy the rest of your week. And Dr. Amigues, again, thank you so much. Appreciate it.
Thank you.